specialization in cancer prevention. She's the president of the International Spiritist Medical Association and has fostered the foundation of several Spiritist associations around the world, including in Colombia, Portugal, Spain, England, and the United States of America. She is also the author of many books of the theme spirituality and medicine and other related topics. Please welcome Dr. Marlene Nobre.
Boa tarde.
Good afternoon. I'm giving my pardon once again for not feel intimately associated with English to be able to speak in English. I hope that I can be pardoned by all of you. Our topic today is spiritual surgery and physical healing. I would begin by saying that the PAS, or surgery, spiritual surgery, is part of that which we know as complementary spiritual medical treatment. Nonetheless, I need to tell you that the term spiritual surgery in reality does not combine with the phenomenon by itself. I prefer to use the spiritual intervention because the nature of this intervention is unknown to us. So, complementary spiritual treatment therapy includes prayer, self-knowledge, with the practice of charity, fluidotherapy, which consists of the pass of magnetized water or fluidified, disobsession, which is a process of release of the creature of a person of a negative spiritual influence. What is the primary objective of complementary spiritual therapy? It is to promote health based on inner transformation, a deeper transformation of the being. Or we could say also that it is spiritual education, the improvement of the spirit. What are the reasons for which a person or people seek out the Spiritist centers in Brazil? To get to know Spiritism, 63%. Looking for solutions to health problems, that's 37%. To resolve mental problems, physical problems, spiritual problems, mediumship, and also they go to the Spiritist Center in the hope of receiving letters from family members who have already passed away. And also for other causes were verified, were indicated in the research of Santos in the Scripta Ethnologica, which appeared in 2006. The results from spiritual healing, there were 92% those reported an improvement, an instance of improvement, a period of improvement. 67% reported a great improvement. 23% said that they had been cured. 8% said they had a small improvement, little improvement, and 2% didn't answer the questionnaire, while 5% of the people didn't notice any change in the situation they were in, and 3% did not answer that question. Spiritual surgeries. Basically, we have two types: without cuts, through laying on of hands or a pass, and with cuts, with skin incisions that are so-called the spiritual surgery. The name we don't accept because we think that in truth we don't really have an idea of the type of intervention or what is the mechanism by which this kind of surgery occurs. Therefore, we prefer to say spiritual intervention, that is only by laying on of hands without cuts, and we also have various modalities of laying on of hands, which would be therapeutic touch, hands-on, jure, Reiki, passes, and the so-called spiritual surgery. From the point of view, the Spiritist point of view, the Spiritist fluids, spiritual fluids, are derived from the universal cosmic fluid, which bathes the entire universe, and from which, perhaps, we have had some idea with the latest experience of the 4th of July, when it was detected, or it was thought to have been detected, the Bosnia cell. Because this, we have known within Spiritism for a long time, has been the universal cosmic fluid. This fluid is not perceived by our common senses, the body senses. In Brazil, we have passes, these interventions or spiritual surgery, the use of magnetized water or fluidified, and we find hundreds of Spiritist centers that serve the population in general for the transmission of an intervention from the point of view of complementary spiritual treatment therapy as part of the normal activity of the spiritual center, the Spiritist center. As our Alessandra has already told us, there exist dozens of hospitals, the Spiritist hospitals in Brazil. In the meantime, not all of them have this type of service. Only those whose directors, the medical and administrative directors, are genuinely Spiritists. Starting there, these other hospitals use the complementary Spiritist therapy. Who are the people that use this kind of therapy? Catholics, evangelicals, Jewish people, etc. So that from people from all religions, the Spiritist centers are open for the reception of those patients. For us, what would be a pass? It's a transfusion of mental energy inducing changes at the cellular level. So it has a resemblance to blood transfusion. In hemotherapy, which you use the blood transfusion, you have a limited reservoir because donations are done principally by an individual. An individual can donate up to 500 milliliters of blood, but in the past you have an unlimited reservoir. Why? Because the universal cosmic fluid, it expands throughout the universe, and it is a source for vital fluid. In turn, the human being produces this vital fluid, as we shall see, so that the human being transforms the universal fluid into vital fluid. And the basic element of the pass or surgery is vital fluid. Finally, what type of energy are we talking about? For Hahnemann, the discoverer of homeopathy, and for Allan Kardec, the codifier of Spiritism, this energy is called vital fluid. For the Orientals, it's chi energy. For Freud and Jung, it's called libido. For William Reich, it's bioenergy. For Henry Bergson, the French philosopher, it's élan vital, vital élan. For Claude Bernard, it's the directive-oriented idea. For William Crookes, it's the psychic force. For Hernani Andrade, a Brazilian engineer who has already passed away, it's the organizing biological model. For Rupert Sheldrake, a biologist in the United States, they are the morphic fields. But finally, it is the magnetic fluid, or it's also known as ectoplasm, when in its visible form, and its materialization of this fluid. What is donated in the past, or in the so-called spiritual surgeries? In these spiritual surgeries, or spiritist surgeries, the vital fluid or magnetic fluid is donated, which is derived from the universal fluid, and which was known in old times, since Mesmer, as animal magnetism. The interesting thing is that all people, absolutely everybody, possess this fluid. Any person here in this room can be a donor, without exception. We are given this vital fluid. Most interesting that in the Spiritist centers, we work with a mixed fluid. What is that? What does that mean? There is an interaction and an integration between the medium who transmits the vital energy and his mentor, or his guide, or protective angel. And this spiritual fluid is introduced to the vital fluid in such a way that it is carried by the guide to the region of the person who needs to receive it. And if there is a surgery, and many times there is a surgery in the simple common pass, this surgery is done by the spiritual guide without anyone knowing about it. That is done by spiritual means. In such a way, as we saw in the presentation by Alessandra, which was very well mentioned here, there are some Spiritist centers. The results for us are very good results in the sense of improving improving the health of the population through the use of these therapies. How is it that we could say, evidently, I'm summarizing everything, how does the vital energy circulate in our organism? It is part of the etheric double or vital body. For the spiritual world, it is considered a circulation of radiant forces. And the circulation of these forces occurs through the hematopoietic system, through our blood. It's interesting because the etheric double disintegrates upon death. But even more interesting is that the perispirit, or spiritual body, is not going to have any more the etheric double, which results from the earthly environment. But it's going to couple, it's going to integrate after death in the plane at which it is located, the material on the plane in which it is located, so that this fluid will remain, but it will no longer be made up of elements of physical material. Therefore, it should disintegrate upon physical death. In the work that's been cited already here by Dr. Giancarlo, in which we participated in doing, the main objective of our work was to discover the scientific bases for complementary spiritual therapies. And you have already seen a systematic review focused primarily on these studies already conducted by rigorous methodologies, so that we avoid all of that which could be not collaborating for a more scientific result on the task. And you saw already in a previous reading the conclusions. I'm simply reminding you here that in relation to the past or the laying of hands, it is evident that there is a positive effect of the past, primarily in the symptoms or behavioral symptoms in many studies on the part of pain. So these results were not very conclusive in terms of treatment of anxiety. Nonetheless, more and more research is necessary so that we can know from the scientific point of view how the pass or the laying out of hands functions in reality, so that we can help the patient. In terms of the mechanisms, we are still feeling our way in the dark, receiving little by little how this mechanism probably is. We did a review of literature, discovering, which has already been commented on here, the increase in enzymatic activity, the reduction of cultures or acceleration of cultures according to the use of the pass, in what way human hemoglobin can increase, reduction of blood pressure. Finally, there exist a number of different studies that demonstrate the action of the vital fluid or the magnetic fluid, which, according to the purpose with which this research is conducted, some studies were carried out showing, for example, the proliferation of human cells in culture, the case, for example, of reduction or increase in the case of weight for recent newborns who were born outside of normal weight limits. Also, the efficacy of the therapeutic touch in terms of pain, the measure of various types of pain or the reduction of cortisol in some cases, the advance or the proliferation of natural killers in certain research that has been conducted, and so forth. What we want to do with this is to say that medicine cannot stagnate in prejudice. And there should be much more research than that has been done to find out up to what point this fluid is normal in us, which exists in all human beings. Up to what point can it be taken advantage of in favor of human health? The cuts with incisions, as you can see here. And now we go directly into research that was done by Dr. Moreira de Almeida with João de Deus, John of God, or his real name, João Teixeira de Farias, which was published in the magazine of the Brazilian Medical Association in 2000. This research shows us then that he works or inhabits or works in a city called Baiana in the Goiás state. And he works 115 kilometers from the federal district in the so-called Casa do Inácio. And this research of Dr. Moreira de Almeida was done between the 16th and 18th of August in 1995. And it was done there because there were caravans from abroad showing an accumulation of patients that was very great, and it was necessary to find out to what point there could be success or not in these operations. It was verified that the doctor, John of God, has a primary education, very basic, and he is a farmer, and he lives from that work as a rancher. Here are some views of where he works. Oprah Winfrey came to see him, and recently he had some visits from showing some interventions that were done there. And what could we say? The task in itself. He is a curer, a healer. He works 3 days a week. He prescribes certain medications that come from the flora, and he adds spiritual surgery. For him, the spiritual surgery is fine, and he uses it constantly. The Dr. Alexandre Moreira de Almeida, the author of the research study, did not detect any collection of fees for the activity of surgery, nor was any contribution solicited. And generally, he lives from the free distribution of soup done by the house to the most needy. Also, she noted that poor people receive the medicine for free, the phytotherapies, herbs. There were videotapes, shirts, were printed with the medium's photograph, and they are sold, rosaries, videotapes, and t-shirts. João Teixeira, or John of God, says that spirits are completely dispensable. That is, the spirits can act directly on the patients. But he leaves the choice to the patient himself. Why? Because the patient may be operated on with a visible surgery with incisions, and these incisions last only a few minutes. And he also can be helped through invisible surgery, which is done in a dark room, and people stay there for a certain amount of time that is decided upon by the doctor. Although in spite of the fact that he is unconscious during the time that he is attending people, he doesn't seem to be in a trance. On these 3 days, from the 16th to the 18th of August, Dr. Moreira de Almeida participated, saw, watched, verified 30 surgeries. 6 patients. They could take their medical history, he could do physical examinations, and also collect tissue for a pathological examination. There was a questionnaire that they could answer, considering religion, level of education, belief in healing, the medical diagnosis, which had already been established in each case, and complementary exams completed, and possibly previous treatments. All of this was noted on a card system. Dr. Alexandre Moreira de Almeida accompanied some patients closer, and as I said, 6 of them, who had come. One came just a single time, another one came twice, and still another patient came 4 times in order to be taken care of or cared for. What is it that Dr. Almeida declared in this same research study? That the medium does not wash his hands between the surgeries, that he doesn't use gloves, nor does he clean the surgical field. The instruments used are sometimes sterilized scalpels, and other times use the same knives used in the kitchen knives. In spite of that, he did not verify any case of infection. He did not observe these cases, even though he has done follow-up on these patients. What did he observe from the point of view of the research? What were the pathological findings that he came up with? He declares that histopathology demonstrated that the tissues are compatible with the source location which had been pointed out, and this tissue that had been removed. He saw specifically the extraction of a lymphoma of 210 grams. He received and also had examined the incision of the skin of the ocular epithelium and corneal scrapings, and he observed the presence of pain, moderate pain, in the case in which there was an incision of the breast. He further observed that there was a expression of pain by the patient. He did not identify any anesthesics or antiseptics in the place. And there were no signs of infection, nor 3 days later after the operation, nor in later reports. The great difficulty that Dr. Alexandra had with this research was that the patients did not come in for the follow-up, and he was not able to do a history that he would have liked to do. What is it that he found as results of this research? What did he find out? First, the surgeries, they really exist from the point of view only of the incision. The incision was real, but there was no effect of cure, of healing on the patient himself. There was not a specific healing. Why? Because the exploration that he did not bring conclusive data in terms of the disease that the patient said he had. In final analysis, the pathological finding was not pathological. That is, they were just matters of taken off of the cornea or some other place, but there was no indication of pathology in the tissue that got to the laboratory. And this is something that he calls attention to in the final results. The difficulty, there were really scrapings from the nasal cavity in the cornea and fragments of the bulbar conjunctiva, conjunctiva bulbar. So, 4 results obtained 6 months after surgery. 2 indicated the following: 2 with a retinal hemorrhage, and the other of chronic sinusitis. There was no benefit with the intervention by the doctor.
By the medium.
2 cases showed an improvement, a substantial improvement. For example, one of the patients, of the 2 of them, had a liver disease due to alcoholism and hyperopry and incapacitating pain, back pain, for 5 years. And there was resolution of the back pain and improved the hyperopry, and also with abstinence from alcohol and use of therapeutic medications that were prescribed, herbs. There was an improvement in the blood tests, GT gamma, etc., and so forth. So these cases were proved up to 6 months after the surgery. Another patient who had a cyst, macular cyst, and idiopathic abdominal pain, was already investigated through ultrasound and laparoscopy. And there was a proposed exploratory laparotomy. The medium and the patient did not want to do that exploratory laparotomy. And the medium, he did the incision in the hypogastrium. There was a resection of a fragment, bulbar fragment of the conjunctive. And there was improvement in visual acuity and substantial decrease in pain. There was an incision that showed no infection. There was no infection shown, nor was there any scarring observed. What were the conclusions of the Dr. Moreira de Almeida? The research of surgeries and extracted tissues were real. That is, surgery by incision and by collection of material. There was no use of antiseptics or anesthetic techniques, and the patients did not feel pain. There was no infection detected post-surgically. Only one patient reported pain, which was the case of the incision of the breast, and the authors did not observe any fraud. The discussion of the placebo effect, it's a very interesting and difficult discussion because the magnitude of the placebo effect in surgery is approximately equal to any other sort of placebo response. That is 35%. Because of ethical and technical reasons, there was great difficulty in assessing the placebo effect of surgery. So this concept of placebo is the subject of numerous controversies, as we know in medicine. For example, Goethe in 1994 says that a placebo cannot be defined in a logically consistent manner because it has contradictions. So there is no agreement on what would be a specific effect of the placebo effect and how it would be established. Our medical Spiritist Association in the United States and in Brazil and throughout the world, we consider spiritual surgeries as being energetic therapeutic interventions or therapeutic intervention. The medium should give it for free what he has received for free. This is a condition of ours, including for research too. And here I say with all sincerity with you that it's very difficult in Brazil, it's been very difficult in Brazil for those mediums to maintain themselves within these ethical patterns. But I remember very well that Allan Kardec in the Medium's book tells us that mediumship is not linked to morals. Any person, even immoral persons, may be gifted with mediumship ostensibly. Mediumship is intuitive to all of us, but mediumship, ostensive mediumship, is not linked to morality. Therefore, what we have learned within Spiritism is that for a medium to act, he has to have morality. The need that he or she has to form spiritist ethics in the case, to act in a beneficial way, and principally it should be a transforming way of his own life, educating himself from the point of view of morals, and principally using mediumship for good, for charity, if possible, and many times it is, with his own personal sacrifice. The medium, he or she, therefore should conduct his or her life as a good person with an unblemished morals. Morals that tell us that we should not do to anyone else that which we don't want them to do to us. So it's primarily we advise and we say that the medium should not use any cutting or perforating objects, so that there can be spiritual intervention. There's no need to make cuts nor perforations of any type. In medical science, we believe that conflict should be avoided between spiritual healing and science by itself, and it has not accepted complementary practices. But within the association believe that this is a normal association. Since Mesmer, humanity has had its attention called to the use of this great force which exists within each one of us for the good of humanity. And unfortunately, due to prejudice, we still are not using them, these energies, in favor of the common good for ourselves. Orthodox medicine, in general, has set very higher standards for complementary medicine than for its own research. And this has been a finding among researchers in Dr. Alexander Moreira Gelme that reminds us of this. And instead of rejecting complementary medicine, we should point out and identify charlatans, because they do really exist, and we should try to advise the population about who are charlatans. But we should not leave aside research and the enormous contribution the vital fluid that it can bring to diseases, helping primarily in the recovery of health. So we don't know anything about the mechanism of healing. Could it be a psychological influence? What is this energy that we don't really know, which goes beyond our knowledge? And primarily, what is the psychosomatic effect that could be added to starting from the use of these therapies? We see that still the answers, that we still don't have them, but we can already with no doubt say that the past works, that complementary therapies that use the vital fluid is a reality in favor of human health. In conclusion, we have already seen that we don't need to take care of analgesia, because normally surgeries are done without pain. There's no infection. We still don't know the mechanisms. We know that the pathological findings do not indicate where the cure comes from. Therefore, we do not have in hands that a real surgery has occurred in the physical field, nor whether there has been an improvement. We know that the surgery occurred in the spiritual field and probably on the spiritual body. And we can conclude exactly as Dr. Alexander said, that we need a lot more research, but we need primarily on the absence of prejudice, so that medicine can make use of a remedy which is absolutely fantastic, that costs nothing, and can be introduced into any situation. Before I end, I would like to say to you that the Spiritist Medical Association of São Paulo and the Spiritist Medical Association from other states are working within the area of Spiritist medicine in Brazil. In the state of São Paulo, we are within the Hospital das Clínicas of the University of São Paulo. The doctors of the Spiritist Medical Association of São Paulo are responsible for the Spiritist operations of the hospital. What that means. Doctors and others, people who give passes from other centers, they get together. They look at their work and they attend patients offering spiritual help, which goes from a simple conversation about the spiritual life, about what exists, up to a pass, if it is requested, or of any other information of a spiritual nature. This also occurs in the Goiás hospital, where a team goes to help the patients. This also occurs in the city of Piracicaba, in the Unimed hospital. And we recently have been getting calls from other hospitals. So we are improving our penetration going throughout hospitals in Brazil. So I would like to pass on to you something that we are trying to do, which is the Health Institutes, which is a partnership of the associations with the Spiritist centers. These health institutes serve the population within the Spiritist centers, but they can have two purposes. The first one is to give help to the collectivity, because the doctor, being a pass giver, can go into the spiritual life, because in the world, in the other dimension, no doctor works without using vital fluid. And something else that's important, that through the Health Institute we could add to scientific research on the pass with the so-called, for example, multi-center research, in which various Spiritist centers carry out the same research. And we are doing this inspired by our mentors, because our association has this characteristic. We live in communication with another plane of life, always looking to understand what are our tasks. And we are inspired by these mentors. And they tell us that it is time, well time, for medicine, for all those who are concerned with human health, to adopt the vital fluid as being an important step in treatment, therefore providing help for improving human health. I want to express to you my enormous thanks, principally for your having been able to put up with me, and to say about the great happiness that I had to be able to come back to Washington and to give a hug to my friend Sonia Doi, who with so much sacrifice leads an institution like this, thanking all of you for all of the support that we have had here, to the speakers who have come to bring their message of so much science and medicine and important things for human life. And I would also like to remind you of an event that occurred and which makes me think. When in 1990 I became a widow, several days later, the Dr. Bezerra de Menezes appeared to me. And he told me that I had a requirement to materialize on the earth the Association of Medical and Doctors. And it was already formalized. It had already been thought of. And it was already within the heart of Christ. And he told me many things. And I wrote it down not to forget. But among the things he told me, we should tell people who would like to hear us, because doctors would be the last people to get into it. But we would have the support of the population. And for this, I thank you. You are demonstrating this support, this unconditional for our work. Thank you very much.